Good afternoon, folks. I know it's probably been a long day for you all, and middle of the afternoon, we'll try to keep you from nodding off. How's that for a deal? Our end of it is to make this interesting and to keep your attention, and I hope we do that. I'm Peter Ashley. I'm with HUD's Office of Lead Hazard Control and Healthy Homes. I direct a small group that is involved in policy development and research. And I'm going to talk to you about how our Healthy Homes program has intersected with energy efficiency, weatherization, et cetera, and why we think that's a great idea. So we've been involved at HUD. We've developed this, what we call the Federal Healthy Homes Work Group starting in 2009. It's a group of federal agencies all interested in healthy homes issues. What's healthy homes? That's kind of a strange term, isn't it? 90% of our funds go for lead hazard control, so directed to mostly local government agencies to create lead-safe low-income private housing. But we have funds to address, there are many other issues. You go into a low-income household, a home, and maybe the furnace is dangerous and could kill the family at any minute. So why not take the blinders off and look at some other things? Maybe there's high levels of radon, mold, pest infestations. So that's the healthy homes concept in a nutshell, to try to address those multiple hazards at once in an efficient way. And that's why this work group was put together. Oh, I see. This is one of these. I wondered about that. So these are some of the agencies that are part of the work group. HHS as well, CDC, USDA. Oh, it keeps on going here. So there you go. I don't want to spend a lot of time on that. The agencies you might expect. And we got together and we wrote Federal Healthy Home Strategy for Action. So like any strategy, a plan to help us coordinate and our efforts and identify some priority actions to work on under specific goal areas. And it was a real pain. It had to go to OMB to get, and get cleared. And it was during an election year, so they looked at every word. But we finally got it out in 2013. Take a look at it if you're interested. It's not as blunt in some places as, and clear because of all this clearance and you have to change this word and that, but we think it's still useful. Okay, so it was released. There was quite a high-level group. You can see none of them are left in their posts. I'm not sure about Daniel Poneman, maybe somebody in the Poneman. Is he still at DOE? No. I think so. They're all gone, but it's still the same administration, the same values. A lot of the people are still there. So I think it still carries some weight. So this is a graphic that kind of summarizes this strategy. Is there a pointer on this? Yes, there is. It's the top. Oh yeah, the little top. So these. So look at the vision to reduce the number of American homes with residential health and safety hazards. That's millions of homes, as you all know. And how do you do that? Well, you make sure that they, once you intervene, that they meet these eight healthy homes principles. Dry, well-ventilated, pest-free, thermally controlled, clean, well-maintained, safe, contaminant-free. So as close as you can get, right? We used to have 7, and then when we put this together, we thought, well, we haven't really covered, the temperature well enough. The fact that they need to be well insulated. So we added the thermally controlled there. And that's where, of course, LIHEAP funds can go to weatherization. They can go to helping us accomplish this. And the speakers today are going to talk about how they've been able at a local level to achieve this aim by finding funds from different sources, federal, state, philanthropic, different pots, putting them together. We have trouble at the federal level. We're still wrestling with how do we do this because our funds are siloed, like our lead funds are for lead. And it's difficult for us to combine the funds in a meaningful way, to achieve these goals, to address multiple issues. We're doing that with our lead grants. We're adding some Healthy Homes funds to our lead grants, but it's not a lot of money, and we really need what you'll see today from these folks. So coordinating interventions, why are we here today? I think I just mentioned that, but this is why we're interested. This is why Department of Energy, their weatherization program, has been interested in this Healthy Homes concept. They started this weatherization plus health program, and the LIHEAP program at Health and Human Services is also interested. You can provide a much greater service to your clients, and as I said, by using funds creatively, it's a way to combine interventions to improve, to get weatherization outcomes, thermal control, but plus making the home a safer place for the residents. So I think I've gotten these points across already. There's a couple programs that are trying to coordinate these efforts. One called One Touch. A woman in Massachusetts, Ellen Tone, who has a consulting firm, got this started. And it really focuses more on coordinating local government activities. So you get the weatherization program to talk with the lead program, to talk with the social services program. It seems like a no-brainer, but a lot of places aren't doing this, right? And so this is a structured way to do it and to have a kind of a single home assessment to help with this process, and a structured way to get these programs to work together. Not rocket science, but it's a very helpful approach. And Ruth Ann today is going to talk about the Green and Healthy Homes Initiative, which she runs, and it's taking that model a step further, bringing in philanthropic funds and more structure. And currently she's evaluating it as well. So that's setting the stage. Our first speaker is from Baltimore City. That's Ken Strong. Ken's the Deputy Commissioner of the Baltimore City Department of Housing and Community Development, Division of Green, Healthy, and Sustainable Homes, which includes the Office of Home Ownership. In previous positions with Baltimore City, Ken served as the chair of the Baltimore City Planning Commission, Division Chief, State's Attorney's Office, Head Bureau of Solid Waste, Recycling Coordinator, Safety Division Chief. It just goes on and on, except the rodent control. I don't know how you got out of that. But Ken has a lot of experience, and also in the private sector. So let's get Ken up here so you can hear about the great things they're doing. Actually, Ken has one of our lead hazard control grants. Just wanted to mention that as well.
Thanks, Peter. Actually, Peter, I was in charge of rodent control for a while. I didn't put it on my resume, but it would have taken more pages. So I have had a checkered career in and out of city government and in community agency, nonprofit work. I'm not sure if it's something to be so proud of that I have a short attention span and have to change jobs frequently. But in the summer of 2009, I had retired from city government. And I unretired to come back to run the city's weatherization assistance program right at the beginning of stimulus-funded weatherization. And Baltimore City was awarded, let me see if this will work. Okay, what? No? Oh, I see. Yeah, okay. So, yeah, that's going to take a while. I'm going to try and speed through a little bit because I have far too many slides and you've had a long day already. But I want to, while this is going through its cycle, tell you that in the middle of the day, thinking about what I was going to come and talk to you about, Ms. R, who lives on Castle Street, called me to say thank you. She's 65 years old, a cancer patient. When she first came to our office, we couldn't help her because she was about to lose her home to mortgage foreclosure. We referred her to the local Community Development Corporation, and they helped refinance her mortgage and get her straight with that. She caught up on her water bills and didn't go into tax sale foreclosure. And when that was straightened out, then she could reapply for us. So yeah, we started out at $15.7 million. They thought we could weatherize, based on past experience, 2,400 homes with that. 50% of them we had to defer to roofing, heating, plumbing problems, lead paint problems. We couldn't weatherize it if it had those kinds of deep problems. And that's some of the people that do in energy assistance programs are trying to help the most because they have the biggest housing problems. They probably have the biggest financial problems with their utility bills and trying to make ends meet and have a good life. So it was painful to defer and say no to that many people. We had to say no to Ms. Czar on Castle Street initially. It took really 2 years before we got the work done. Her gas and electric bill was $325 a month. And that was on the budget payment plan because she was so far behind and her house was so energy efficient. She has an adult disabled son who's a burden and not a help to her. She takes care of. She had not enough money for food. And so when I visited her, my next step was to Meals on Wheels. She's getting regular nutrition now. They also, and this is cute, I don't know if you know this, but they bring a meal for her cat. The Kibbles Foundation, you know, supplements Meals on Wheels, but it's very sweet, and she was very grateful. And then we put together the money because we had flexibility. You'll see where it comes from later in my presentation. That we did a lot of fixing up of her home beyond what weatherization usually did, and so I'm very happy. In the normal course of things, we would have people applying. They'd go through the whole application process. We'd have to say no, refer them somewhere else, and there always wasn't a somewhere else for them to get help with roofing and heating and plumbing and other things and health and safety. And then if they did get it, then they would come back through for weatherization and a long time later possibly get help. And we knew that that was not the right thing to do. So Ruth Ann Norton, who's going to speak to you in a little while, called me, like, not even on my first day at work. It was before I even got to my desk. And she called me and said, you have to put energy into health. And you have to keep health in mind in energy. And from day one, I was part of the Green and Healthy Homes movement in Baltimore that's now a national movement that she'll tell you about. And we also had the very beginnings of the Baltimore Energy Challenge for energy conservation education that went along with weatherization and did in-home, close-in education and work with families to save energy because behavior isn't as important as housing conditions. And we had a foundation group and nonprofit organizations who came together and tried to fund innovations in this area. And that was the Green and Healthy Homes Learning Network, met regularly. We got money from even the Utility Foundation funded roofing and heating system work, gave us $1 million, that we overcame some of those obstacles that we had encountered, and we formed something called the Light Team. And the idea of the Light Team was the genius of a gentleman who will be in your group at your next conference. Matt Lyons is becoming the Director of Energy Assistance in the state of Maryland, but it doesn't start until next week. But this was his concept, was leading innovation for a green and healthy tomorrow, and we worked with neighborhood organizations, community agencies that had resources, government agencies, and we tried to come up with some complex solutions to difficult problems, and very often we did. Took a lot of case management, and an example was Ms. J, who had high energy bills, chipping, peeling paint, and a young child in the house, disabled senior citizen with a history of falls, no CO or smoke detectors, lots of problems, and she would have been rejected before, but with our program we came up with some solutions for. And how often does that describe the people that you and the agencies that you're working with? There's not just one problem. It's not just energy assistance. It's a complex of things, and energy assistance isn't the solution. It helps in lots of households, but it's a whole complex of things that will make a family sustainable. And we try and figure out what they are, both in terms of the family and the household. And that's what the Light program was all about. We did it in a lot of cases, working closely with Ruth Ann Norton's group and others. And then we had key partnerships and we had key funders. And I'm speeding through these things. So we reorganized their division, and then Exelon bought up our local utility. And our local utility said, you can do that, but you have to create a fund to help low-income families, $100 million. We, in city and 3 other city agencies, applied for it. We got $52 million. And for once in our lifetime, and we still have it for one more year, we had enough resources to do some of the complex things that we knew needed to be done. And those included the energy benefits assistance. Our agency that does energy assistance in Baltimore is called the Mayor's Office of Human Services, Community Action Partnership. They do comprehensive benefits and screening, not just energy assistance. I know many of you in your states and localities do too, but then they could hire 15 additional people to do it because it's more labor intensive. And so that's been part of what we've been doing. We were able to hire more people in the Light program, do more house repair and comprehensive work. We targeted especially high energy users who had the highest energy bills and did some creative things with them. Heating systems, Peter mentioned it, one of our biggest problems. So it's not just the dangerous and dysfunctional furnace, it's the people who are still heating with oil and spending way too much. And so we got several $1 million in this fund to convert 1,000 families from oil to natural gas. The average low-income family saves $974 a year. I see some speed readers are actually reading these slides as I click through them fast. So lessons learned. We have to make public and nonprofit partnerships real. So Ruth Ann and I were doing that just in the hallway, you know, out here. It's not easy. We're in partnership and in business together, but we have to get government to pay on time. We have to get work done right. It's a lot of intensive work, but we have to make those partnerships real, and we're doing that. The foundation community is still important to us. I only have one more year of that special Exelon funding. I'm looking to foundations to help me continue what I know is successful, but we did get $1 million from the Weinberg Foundation for fall and injury prevention for all the seniors that we're working with. It's billions of dollars goes into the health care costs of seniors who fall and break their hips. One of the biggest reasons for seniors going into hospitals and running up costs, sometimes repeatedly, or dying earlier than they should. For several $100s, you can fix fall and injury hazards in a home, and extend the life and the independence of a senior for a long time. So we're working on initiatives now to do that. You have to make government work better, and that's a constant. I'm not done. I'm nearly done that. We have to do some economies of scale. So they expected us to weatherize 2,600 homes. With the 15.7 million, we weatherized 4,407 because we had economies of scale. And we're trying to measure everything so we can prove everything. I'm almost done because this is what it's all about. So this was one of our favorite clients. She's standing in front of the new furnace, and you look at that smile on her face. She got a whole raft of the kinds of comprehensive housing improvements and human services and benefits that we've been talking about. She's our champion in her neighborhood. She has house parties, tells everybody about us, sign up, get involved, and, join the party. And that's what we're trying to do more of, and that's my story, and I'm sticking to it.
Do you want to take questions after each speaker or wait? Okay, let's get any questions for Ken while it's fresh in your mind. You'll have another chance. I just wondered if there were one or two. Nobody wants to know how to get $52 million for your program? Okay. All right, let's move on to our next speaker, and that is Ruth Ann Norton. I'll introduce you, Ruth Ann, while you... Well, yeah, you figure that out. So Ruth Ann serves as president and CEO of the Green and Healthy Homes Initiative. A leader in the field of healthy housing, she leads a groundbreaking national program underway in 21 cities that uses cross-sector collaboration to efficiently deliver green, healthy, and safe homes in low-income communities. Ruth Ann is a leading expert in social impact financing to scale healthy housing. She serves on numerous boards and commissions and is a key partner for the National Energy Efficiency for All effort. And Ruth Ann, over the years, has had several of our grants from my office, earlier grants targeting lead hazards, and then Healthy Homes, what we call demonstration grants, that were geared towards integrated home assessments and interventions. And currently she has a what we call a technical study or research grant to evaluate some of the interventions that they're doing in the Baltimore area.
Thank you for sticking out the afternoon and giving us your time. And I'm actually on a sick day today, but I wanted to be here because I think the work that you do is so integral to what really matters to us, which is families, and the ability to lift up and collaborate in partnership in government. It is an obsession of mine of helping get past the perceived barriers that we often have in agencies and get to the real work that can happen through collaboration. So I appreciate you allowing me to be here and share with you this afternoon a little bit about the Green and Healthy Homes Initiative. And okay, I see. Okay. Now, we all have the same surprise when we get up here. But so our mission and our vision is to break the link between unhealthy housing and unhealthy children. It's pretty succinct and it's pretty straightforward. I'd like to say that that was some brilliant idea that I had one day and wrote down, but it wasn't. There were 9 parents in the city of Baltimore who lived in the 800 and 900 block of North Washington Street, which will not mean much to most of you, except for that is right outside of the Johns Hopkins Hospital, one of the premier health institutions in the world. And that was 1986, almost 30 years ago. And those parents had their kids were in the hospital suffering from lead poisoning. And at that time, children with elevated blood lead levels who warranted hospitalization stayed there for 28 days, receiving chelation. And most often went back to housing that was unhealthy, that was dark, damp, dusty, and had extreme heat and extreme cold. So we were very fortunate to have our beginnings start with the 9 parents who helped to start what was then called Parents Against Lead and is now GHHI. But this was their vision. And what they knew as they endeavored for 7 years as a volunteer agency and then hired their first employee, who said, I was going to stay for 2 years, 22 years later I'm there, is they knew that the issue was bigger than lead poisoning. And it became very clear to us in our work as we endeavored on lead that in fact it is bigger and that we have to work together around all of this. So we created the Green and Healthy Homes Initiative after years of work focusing on lead poisoning prevention, where collectively, with the help of HUD and the help of our city and state agencies, we've reduced lead poisoning by 98%. But what we learned in that was that fixing houses for lead was not enough, that we were leaving behind kids with asthma. We were leaving behind people who were putting BG&E bills in their kids' names, our utility, right? In their kids' names, there was mounting debt, and they were moving consistently, fleeing bad situations and bad housing. We also came to understand that weatherization and energy efficiency was really our ticket to move not only advance lead poisoning prevention in this country and advance healthy housing, because energy programs touch more houses in rehab than anybody else, but we saw it as the conduit that would leave behind people like Danielle Smith, a Head Start teacher who was on low-income heating assistance, trying to get by as an assistant, whose son was repeatedly going to the hospital, running up $48,000 worth of bills every year. And she was one of those families, like the families that Ken talked about, that was getting turned down for the lead program because she had issues of mold, mildew, and moisture, was getting turned down from the weatherization program because she had a lead problem. And we were asking families before we came to really realize that the 238 lines of different funding that exist, that you have money to put toward moderate rehab and heating assistance, maternal child health block grants have money, lots of money exists in pockets that wasn't working together. And so people like Danielle Smith were losing 23 days of work time just to chase the grants that were necessary to try to fix the things in the home so that she could take care of Achille, her son. And so we formed this program to not only do the cross-referral and sharing of data, but to put into action effectively the work that families deserve to have. We tell Danielle Smiths of the world, go to work. And then we say, but go chase 5 programs, meet 5 different inspectors, fill out 5 different kinds of applications, and by the way, your son's in the hospital for 4 weeks every year. You can't do that. The families that we endeavor to make successful, we can't undermine them on the pathway to success. So that is why we brought, with the Council on Foundations in the White House, and great people like Ken Strong, we launched the Green and Healthy Homes Initiative in 2009 in 10 cities, driven by philanthropy to improve health, economic, and social outcomes, but also to lift up and liberate people in government to do successful work by collaborating. And so that's who GHHI is. You shouldn't get me on a sick day. I can talk a dog off a meat wagon. So we try to provide optimally efficient and effective services. We teach governments. We work through mayor's offices, county executive offices, and governor's offices around the country, and through what we call an outcome broker who drives the coordination. We try to teach how optimal and efficient ways of effective service delivery, and we do it by looking at what resources exist, helping to identify the gaps. You saw much of that great work with Ken. We identified gaps. He saw that there was roofing issues. He went out and got $1 million from Constellation Energy. He saw that there were other needs to do this work and expand, and he got $52 million. So, lots of people are great in government. Ken is expert at that. But what we're also doing in this work is helping you and us to think about how do we scale this work, and we scale it by changing policies. So families that you are seeing whose kids are suffering from asthma, suffering from lead, often you're paying the bills for that. You're footing the bills for energy. Peter's footing the bills for housing intervention. And if you do it right, the savings comes in the healthcare industry. So we are now on a path to try to get Medicaid and hospital systems and managed care organizations to invest in energy efficiency, because extreme heat and extreme cold are major triggers for asthma. Because we know that if we improve and keep kids out of from asthma, and we can do that, that we will also do something else, and that is attack the #1 reason that children miss school, right? So if they're not in the hospital and they're in the classroom, they have a better opportunity to learn. We're also in our work training contractors, weatherization and energy contractors and general contractors, to become that new face of healthcare, to be able to do the work that actually makes people better. Not just housing code, which is critically important, but those things around pest management, mold, mildew, and moisture, indoor air quality, because in improving the house in that way and knowing how to do it, they become part of the prescriptive care in the community that makes kids and seniors better. We spend about $100 billion a year just on asthma and lead poisoning, and another $22 billion a year on fall trips and falls that we can prevent. And all of that can be solved, and much of it through healthy housing. So one of the things also in developing the pathway of financing to help match your work through healthcare is that we are doing social impact bonds. This is investments that are coming into programs such as our program from the private sector. Bank of America, JP Morgan Chase, foundations, even Goldman Sachs, that we've all heard many things about wealthy Wall Street. What has changed in America is there is a new set of millennial investors who care about getting a return on investment, but also care that we do not live through another experience of Freddie Gray. It is a different change than the foundations that existed 20, 30 years ago that often were people who did some pretty bad things, and in their, I would call it, kind of guilt, leave behind money to do better things in their death, build endowments. The new age of investor is saying, I want to see it happen now. And there is a social consciousness that government is able to tap through social impact bonds that we're trying to help fund what works. And much of the work that you're doing helps to do that. And so that's part of the best practice adoption that we're doing on standards and policies and practices. And I said around the Medicaid work that we're trying to do, if we are able to work together and get Medicaid to invest in housing interventions, it is jobs, it's healthier children, it's more stable neighborhoods. And I will say to everybody in the audience, if we can do this right and everybody lands up needing another job, I will personally find you another job, because we can do pretty well on this. This is where the Green and Healthy Homes Initiative is working today, where the green dots are. The purple dots are those cities and states and who have put forth applications to follow our standards and work with us on implementing these standards and practices and principles. And so we are looking to expand this to 60 cities by the end of 2017. And to be able to influence, at least with our partners such as the U.S. Department of Housing and Urban Development, influence at least 500,000 homes that it will be greener, healthier, and more stable. We already know these things. You've heard a lot about this from me, and I've gone ahead of my slides here. I'm not good on slides, but I do want you to pay attention to that 14 million school days missed a year, because that is where the nexus of unhealthy, energy inefficient housing, that's our price we're paying, is kids who are missing out on educational opportunities as well as the healthcare cost. This slide just represents the, when we first started Green and Healthy Homes, as we wanted to start to align and braid and coordinate resources and helping governments to do it, where we have seen an average of about 25% savings by doing this work for governments, is just a representation of what families face and how they're trying to do that. And for us, the aligning came about in some of the work that was done that Peter talked about in the interagency work group for healthy housing, getting the Department of Energy and others to expand what they could do on health and safety work, and implementing what the interagency work group has found is effective through their strategy for action. And I know Peter had it up on the thing, but I would encourage you to read it and help to implement it in your state. We will help you do it. On the local level, we are braiding resources from various organizations, including philanthropy and private funding. But for us, that means single application, where Ken was talking about going in the field and taking in applications and doing that so families aren't chasing individual programs. We are still working on a federal policy to try and level out eligibility so that each federal program doesn't have differing eligibility. And we do our work through a comprehensive assessment that looks at health, safety, and energy in every assessment so that we do not have to send in multiple assessors, and that families can get one assessment, and we share that data from health departments to housing departments and across agencies. And in our work, as we also do this integrated scope to address the health, safety, and energy issues together, key to it for us is having environmental health and energy educators that start at the assessment, stay with families through the remediation, and then follow families through post-remediation. The education about risk awareness, how we're fixing it, and how to maintain it over time is critical for health, but it's also critical to maintain the investment piece. And then we are obviously collecting data and evaluating that data for other forms of investment. So this is our little logo slide, or our infographic slide of how we work in addressing lead, asthma, and energy efficiency. And I'm going to, I think, cut my slides down here so we can hear from Bill as we do this, but I'm happy to talk about the single portal of access, the comprehensive assessment that we do, and how we look at that, as well as our intervention and education. So I'll just kind of flip through these so we can get Bill there. And I will say our assessment form, this comprehensive assessment that looks at the 29 elements of healthy housing, or healthy homes rating system that HUD has, combined with energy, has been adopted by the state of Maryland. And so it's moved on from beyond our organization and the 21 cities. It's now being used by our state agency to coordinate their work on the similar funding that Ken has. And we think that's really important on behavioral health as well as structural. So I can't get through these slides very quickly. Well, I will say this is just a list of the things that we address when we go in into the housing unit. So we're looking at all of these as a baseline. It's the floor, not the ceiling, of the work that is done in every one of the houses that we're looking at. And then we spend a lot of time on post-remediation education. And we actually, in our program, and the program that Peter was talking about, the tech study, but in all of our programs, we're following families where we can for a year, so 1, 3, 6, 9, and 12 months, to ensure that our work is improving those health, economic, and social outcomes for families. And in our one study that we did, and then I think this will be my last slide, sorry about the slowness of the slides. We did do a study on one of our HUD-funded Healthy Homes program, Healthy Homes demonstration programs, that really has put on fire and ignited our work in the social impact and private investment side, where over a 3-year period, addressing 139 families who followed all the way through in the full data collection, we had a 66% reduction in hospitalizations and an almost 30% reduction in emergency department visits. 74% of kids reporting that their improvements in asthma. But the better piece of this is the 62% movement from frequent and chronic absence in school to perfect attendance. That's a big deal to us in Baltimore. And an 88% improvement in parents' ability to work. So I'm going to go there and introduce, or have Peter introduce the illustrious Mr. Long from EPA. Thank you.
Thank you, Ruth Ann. Before Bill starts, are there any questions for Ruth Ann from the audience?
Where are you from? Yeah. We have an office in Jackson, Mississippi. Come and work with us. See, she has a question. Sure. Here you go.
Can you take us through the process? You say you're a one-stop shop or whatever. So
for most of our core programs, yes. Yeah.
Okay.
We do a lot. We run a foster care inspection. We do a lot of other things.
So a client or customer comes to you, and then you do an assessment to determine what are the needs, and then you're partnering with other agencies and counties, and then you're providing them services at the same time.
Let me talk about the family who comes to us directly, because we also get referrals from Ken to do work. So there's lots of different things, and we have a fairly robust program in our organization. We have one of the few housing choice voucher programs for lead poisoned children. I think the only one in the country, because of our good partnership with the city. But a family will get referred to us from the Harriet Lane Clinic. They're one of the Hopkins clinics, right? That child has hit the emergency department because of asthma. They will refer that family to us. We then will send out an environmental health educator, assessment and education team. Our assessors are Building Performance Institute trained, right, and certified. They've been trained in healthy housing and lead and structures, and also in integrated pest management. So they are very well-rounded assessment, right? And the education team are certified in asthma education and all of the environmental health factors, right? And so we send that team out, and they will do a full assessment of the home and start the reiterative education with the family. From that, we write a scope of work. And in that scope, that will show us where we need to go for funding. If we have it, we will pull from our various funding streams. If not, we're going to be calling people like Ken or other organizations and say we need to couple this money. Now, Ken is now in the Baltimore program. He's the main driver of the model and has really improved that model. So he's the big driver of that. But that's the concept, right? It is braiding funding. Maybe it's 25% from our low-income heating assistance, mod rehab program. Maybe the other money is coming from another part of our funding on energy efficiency. We will couple that in from funding from philanthropy or from the city on healthy housing, and we may have a lead paint grant that needs to go into that. We get that work done on an integrated fashion where we can, meaning having the contractors be cross-trained to do that. And then once that is done, the education will continue with the family. We'll do a post-education meeting with the family and the property owner if it's a rental property, showing them how to do gutter cleaning and how to maintain the health standards and change filters and all of those things. And then we do follow-up with the family, helping them to remember some of the things they need to do. Also in that education is medication adherence. So if they have clinical things, asthma medications, or it may be an older person who's got medications, we try to make sure that we're doing support of those clinical pieces. So in the end for us, our long-term vision that has been moving along is to be able to effectively have a script written in the clinic or a referral from programs who are basically able to say you need to get the assessment, the education, the intervention, and then we are pushing the envelope to find new ways to fund that, because there's thousands of families that need this help, and we can't do it by government alone. I hope that answered your question.
Thanks, Ruth Ann. Okay, we'll go to our next speaker now, and that is Bill Long. Bill is Director of the Center for Radon and Air Toxics in the Indoor Environments Division with the U.S. EPA in Washington. A great colleague of ours in our Healthy Homes program. Bill has over 20 years of experience directing national and international environmental programs to improve air quality and save lives at the EPA.
Thanks, Peter. Hi, everyone. When is the break? 3:30? What time is it now?
3:35.
Okay. All right. I promise you I'll go quickly. Hang in there. I think Peter wanted me to mainly talk to you about a new product we have coming out shortly, so I'm going to just give you a little bit of context of who we are. Have you ever had EPA come to the LIHEAP conference before? No? What do you think of when you think of EPA? Science? Regulation? We're a part of EPA. It's kind of neat. We're a part of EPA that doesn't do any regulation. We're focused entirely on non-regulatory voluntary programs about education, outreach, guidance development. So it's kind of neat. We get to really focus on the high-risk things. And the indoor environment can be a very, as you all know, a very high-risk place for people, for families. And when you weatherize homes, when you tighten them up, when you upgrade them for energy efficiency, it can get worse. Our office is focused on a range of issues. Sometimes they're covered by other parts of EPA that have regulations, but we're kind of the one-stop shop for the agency with regard to the indoor environment, dealing with combustion byproducts, radon, secondhand smoke, asbestos, lead, VOCs, moisture control, mold, many of the things you all deal with on a daily basis. The good news is indoor air quality is a growing issue. It's not fringe or weird anymore. It's being embedded into lots of the rating systems that are already in place. Oh, okay. And it's also embedded more and more increasingly in codes and standards throughout the country. These two areas are a big place for our effort and attention, labeling programs and codes and standards. I think that IAQ is becoming more and more valued. Owners and occupants value it because of the health benefits, the comfort benefits, the cost savings and the value that they can accrue. Builders value it because it's becoming more and more of a demand thing. People equate healthy homes as a quality home. Ironically, it seems to maybe sometimes sell better than energy efficiency. Sometimes maybe energy efficiency, people are expecting 100% cut or 50% cut in their energy bills. Doesn't really pan out. But when you talk about health, the health of their kids, the health of their family, the health of their elderly, that can be a real selling point. And then landlords value it, I think, mainly because of it can help you not get sued if you do things right. I just wanted to say just maybe a special word on radon. This is a real important issue for me. Peter gets sick of me talking about it, but it's such a high-risk issue. When your home isn't healthy if it has high radon, we know it's a challenge for you in terms of using LIHEAP money and weatherization money to address radon. We know that. But there's lots of places that have been creative about finding ways to test and fix for radon. But lung cancer is a terrible disease. Only 15% of people are alive after 5 years. I bet everyone in this home, in this room, has a family member who's been touched by lung cancer. So please do everything you can to really address and confront the radon issue. It's one that's sometimes difficult to deal with because it costs money to fix. But unlike a lot of environmental issues, it's simple. It's not complicated. It's easy to test. And when you put a system in, they last. End of soapbox. I just wanted to mention our partners. There's been such a step up recently in the federal government about IAQ. I'd like to point out the Peters Group, HUD, a couple years ago or last year, they did a new rule on radon testing in their multifamily housing. That alone has spurred tremendous action around the country. And it's not just our federal partners. Our NGO partners are doing great things. And Ruth Ann's group, they're wonderful. She is too modest to tell you this, but they were one of 2 national winners this year for EPA's National Management Program for Asthma Interventions. Here in Baltimore City, her group is directly saving lives because of asthma in Baltimore, and we really saluted them this year with our award. Yeah. Actually, if you want to hear that story, Ruth Ann's story is up on our website. Check it out. Just go to epa.gov/IAQ, and you can find a webinar that tells that story. So please go visit our website. I don't want to talk about. I won't bore you with this. We're trying to make the connection, let people see the connection between climate change and IAQ. But what I really wanted to talk about were these things. These are new products we have. We're hoping you can use them. They're really the first of their kind protocols for assessing and mitigating the most common and serious risks you're likely to encounter during upgrade and energy efficiency weatherization work. What the risk sources are, when you might encounter them, what you might be doing to exacerbate them, how to assess them in specific cases, and how to respond to them during the course of your work in energy upgrades. We have already out the single-family one and the schools one. They're out there in use, and very shortly, in a matter of weeks, we should have the multifamily document out. These are great products. You can literally take them and drop them into your program. They're comprehensive. All the issues I mentioned at the front when I started talking, they're addressed in them and more. There's a set of minimum actions we recommend you take, and then a set of enhanced actions that we recommend programs take. So my main message is please take a look at these and consider adopting them in your weatherization programs. We know that, again, funding is a problem. We know that you can only spend so much of your scarce resources, your valuable resources on health issues. But if you want the best-in-class guidance out there, backed by the best science and the federal government, the EPA, these are the products to use. We're excited about them. We are going to be thinking about how to spread them in the marketplace, both among sort of philanthropic and funders, government funders, and the private sector adoption. We're a small group. We don't have a lot of people, so we're going to need to think through the most important ways we can encourage adoption of these things. But you're the first group that we're telling about this multifamily one, and we're excited about it. We hope you consider adopting it. Thank you.
Okay, well, let's open it up to questions for any of our speakers at this point. Anybody?
I was just curious how you currently navigate the different income and asset eligibility requirements for the different programs when you're blending the funding streams. Obviously, I would assume you're talking about the lowest of the low people so that they fit under all those, so that you can get them TANF and food stamps and Head Start and Medicaid and this, that, and the other. So is that who you're targeting right now? I know you're working on maybe combining some of those, or streamlining.
Yeah. So Ken Strong from City Housing. The easiest, that's the hardest, one of the hardest things. So you put, and it's a changing target. So stimulus-funded weatherization was 60% of area median income. Weatherization is now 200% of poverty. CDBG funding is 80% of area median income. So what we try and do is have a suite of programs that are applicable to the range of income requirements. So if you can't get 200% of poverty weatherization grant, in our program now, as we funded it, you can get a 0% deferred loan. You pay nothing on it as long as you live in the house if you're between 200% of poverty and 80% of area median income. And we use CDBG funds and some of the Public Service Commission money for that most favorable loan for families that are over income for the lowest grant programs. But it is a challenge. It's not at all easy.
I think the only thing I'd add is, I mean, we are looking at low and very low income families who qualify mostly, but it still is often, as I visit and work with jurisdictions around, people just have the barrier that it's different, so therefore they don't, and it's braid. Blending gets us into jail. Braiding allows us to go right up there, so it's braiding. So I don't think either one of us want to go the other way. But it is a perception issue sometimes more than it's a reality issue for most people. And we do have cases where we have to go find other resources where somebody may tip it. But it's I think we would do a good service in this country if we would level out. If you've got a child on WIC, you've got Medicaid, we should be able to get you into almost every program without discussing the difference of eligibility.
Any more questions for our speakers? Oh, yeah.
Earlier this morning, we talked about performance measures and outcomes, measuring outcomes. When you have multiple funding sources, can you talk a little bit about the challenges of properly crediting each funding source without duplicating or double counting the results from each funding source?
Okay. Want to take it first?
So another good question. That's not easy, and there's no simple answer to it. What we try and look at is not which of our programs had what percentage of the outcome that we were hoping families would receive. But if we're looking at, well, what was the BG&E bill before we did this suite of things? What is it after? And we had different contributors to that. We had roofing, we had a heating system, we had standard weatherization. I don't really care which one did, which to a degree, if we can have a result that family is more sustainable on a budget that's affordable with the utility bill. And similarly in health, it's very hard to say which of the things, even within a program, just looking at one funding stream in one program, like asthma reduction, which of the things did the most to reduce the asthma triggers and hospitalizations. But if you look at before, several visits to the emergency room, after, no visits to the emergency room, sure, scientists want to know which one did what, but I don't care.
And a different take on this, so I totally agree with that, and I think it is the complex environment of the House. But for each program, we do strictly adhere to the outcomes, right? So, and if we have multiple funding sources within a house, we're only counting the measures related to that grant and not double counting it. And if there's any gray area, only one will get counted for that, the reporting purposes, so that we stay in good guideline with, I always want green from Peter Ashley, and for any of our grants that we have from EPA or DOE. So we're careful about that, then you're able to do it. But you're going to have the larger outcomes around health, economic, and social outcomes that Ken was talking about, and that comes from the braiding piece.
Any other questions?
Yes, I had a question of the audience. Oh, but you had a question first, didn't you?
Right. Right. We try to do a lot of kind of facing documents on intake and on education and the like, and so our comprehensive assessment, for example, took all of those things and incorporated it into one document, and we share that with the families. So, yeah.
One of the greatest things that we achieved is with our energy assistance program in Maryland, where somebody applying for weatherization does not have to provide all of those income qualifications all over again. We draw down from energy assistance those documents, and they're qualified. And then we also we try and streamline as much of this as possible and work through sharing. But in our lead program, the health department initially felt that they could not share with us the blood lead level test results that would enable us to know this is a family who needs our help. Crazy. You know, there's an obstacle, but it's HIPAA. You know, they were right by the law. So we got our law department to spend a month on it. They came back and said to the health commissioner, designate housing as a public health agency for the purposes of this program and give them the blood lead level test results so they can help people. And that's what's happening now. But it's not simple. You have to work at it.
Do we have time for another? Okay.
So, Peter, I did have one question of the audience.
Oh, yeah, go ahead.
Yeah, just real quick. But if anybody around the country has some successful experience, not just helping people with their gas and electric bills, but also helping people with their water bills, please come up, take one of my cards, and tell me what that experience is, because we haven't cracked that nut yet, and it's a horrible nut. People are getting their water turned off in Baltimore like they did in Detroit. They can't pay their water bills, and it's the same underlying problems that we're all trying to deal with to help low-income families make ends meet. I'd love to have some successful models.
So in that pitch, can I do one more thing? And Ken, I'm going to pitch this to you because I encourage you to join the non-energy health and water benefits group of the Energy Efficiency for All. So Energy Efficiency for All is a group funded by MacArthur and the Energy Foundation and JPB that is trying to get people in government and the private sector who are working to improve housing, often multifamily, but now we're spreading that out. And how do we implement energy efficiency and water savings along with our programs? If you want to know about Energy Efficiency for All or its work or that resource, I've got my card up here too. And I also have brochures on our work in case it is helpful to get you thinking about the work you're doing in collaboration, in partnership in your community. Mr. Long, where are your pamphlets available at?
If you go to our website, you can see all of our publications and an ordering form if you want to get hard copies. And that would be epa.gov/IAQ. Yeah. Yes, ma'am.
So I've got a question for Ken and Ruth Ann. So you two are kind of the cutting edge at delivering these services in a coordinated way. What recommendation do you have for members in the audience who just want to get started? You know, take a couple of baby steps, do what they can to contribute. You know, these are LIHEAP, they're energy weatherization funds, and they're subsidizing fuel costs, energy costs. But what would you say as first steps?
So if I was a director of an energy assistance program and hadn't taken a first step yet, what I would look to first is expanding the suite of benefits that I could offer people. So when they come into me for energy assistance and they're bringing in all their eligibility documents, there are computer programs that are pretty readily accessible, that can be adapted to a state or a city to analyze, oh, you're also eligible for low-income property tax credit, for food stamps, for several different programs, and at least inform people of what else they're eligible for. And if you can get the right computer program and jizz it up enough to get to print out applications from those different programs, because you've already put in the name and address and a bunch of other things, that's where I would start.
So I would start with doing what we call a learning network. It's how we started this work, and get your partners in government, the nonprofit sector that are in your community, and do what we would refer to as a resource and gap analysis of what you all have to offer. So somebody's got those programs that he wanted to put into his program, and be disciplined about the meeting of that learning network, of having some achieved outcomes that you want, and even if it's to do 3, 4, 5 houses as a model. That's how we have started many of our programs. We started in Buffalo and helping them think about this, and they started out with a model of 5 houses. They've now put $10 million additionally into their programs and have done way more housing. And now Syracuse and Rochester, their neighboring communities, are expanding their work around healthy, safe, green, and healthy homes, actually around those communities. But I think you have to have the time to have a meeting of partnership with purpose, of the collaborating resources, and then you can figure out where you can actually braid to do that.
Thank you. Thanks for your attention today, and please join me in thanking our speakers once again.